Hello, this is Dr. David Green, CEO of the Texas Pain Network. Today's topic is radiofrequency ablation for back and neck pain treatment. Back pain affects 90% of Americans at some point. It's the second most common reason people go to see a doctor, just behind the common cold. It's a leading cause of disability in those under the age of 45, and it's seen in up to 40% of those who undergo back surgery, which is FBSS, failed back surgery syndrome. As far as neck pain, it affects about 10% of the population at any one point in time, up to 45% each year, and 50 to 70% of individuals have neck or shoulder pain at least once in their lives. When you look at the joints that comprise the neck and the low back, they're called facet joints. They're about the size of a thumbnail, and they're bilateral. So you have one at left, one on the right, left, right, at every level from the neck down to the sacrum. Collectively, they provide amazing range of motion for the spine. They are prone to arthritis, just like other joints, because they do contain cartilage. 45% of the time, the facet joints are the cause of someone's neck or back pain. The disc is about 40% of the time, and then another percentage of the time it's either something like the SI joints or something else. We don't have a successful joint replacement for the facet joint as of yet. So to make the diagnosis of a facet joint arthritis or facet joint syndrome, as it's called, entails a combination of history, physical examination, x-rays, maybe a CAT scan. It really is a combination of things. When you look at a CAT scan, you can see these are facet joints here. Okay, they look great. There's a lot of smoothness here. The joints are wide open. When you look at this person who has facet arthritis, it's irregular joint surfaces. It's hard to even see the joint. Okay, there's bone spurs. So that is significant facet arthritis. Interestingly enough, this person may have no pain at all. There's no real correlation. So it ends up at the end being a coin toss. Severe pain may be accompanied by very little arthritis on imaging studies, or vice versa. Even the best trained, board certified, fellowship trained spine doctors end up getting it wrong about half the time. So one way to further make the diagnosis is with diagnostic injections, and this is a medial branch block effectively. The medicine is being put around the joint, not necessarily into it, although you can do that too. That's a facet block. And if that provides pain relief, then the pain doctor can sit there and say, aha, that's why the person's back is hurting, that's the joint. Okay, so it can be very effective as a diagnostic. And these procedures can help provide 2 to 3 months of pain relief. So they're not only diagnostic, they're therapeutic. All right, some say 50% is a positive result if you get 50% pain relief from a diagnostic injection. Some studies show that 80% pain relief is more accurate. Basically, what insurance companies look for is going to vary depending on the company, but some require 80% pain relief on 2 separate injections before approving a radiofrequency ablation. So, like I said, medial branch block may provide pain relief for 3 months on average, so it's also therapeutic. When the pain relief wears off, the person can either have the injection repeated or can move on to a radiofrequency ablation. So radiofrequency ablation has a lot of names. Radiofrequency neurotomy, medial branch neurotomy, thermocoagulation, radiofrequency denervation, lesioning, RFA, RF procedures, they all mean the same thing. So 5 facts about RFA. The current used is actually the same wavelength as radio signals, but there's no FM radio involved in the procedure. You can actually have more pain after an RFA than before, and that will dissipate and get a lot better. Pain relief itself may last for upwards of 2 years. Usually it's 12 to 18 months. You do need the diagnostic injection prior, as I mentioned. It's been a revolutionary treatment for back and neck pain because of the effectiveness. What exactly does an RFA do? Let me show you here. This is looking at the spine from the side. This is a nerve root coming out. This is a facet joint. Okay. Now you see these little nerve branches coming off the actual nerve root? These are the medial branches. All right. So if you look down at this facet joint, there's medial branches coming down and providing sensation to the joint, and there's medial branches coming up. Okay. They both provide the comprehensive sensation for the joint, no motor function at all. Okay. So if you deaden these with a radiofrequency ablation, then you can decrease the sensation, meaning you'll decrease the pain, but it has nothing to do with motor function because you're not affecting the nerve root at all. The procedure itself involves the placement of several catheters because the newest machines allow up to 4 joints, so that here you have 2 bilateral, okay, at one time. This is placed under image guidance, known as fluoroscopy, and then an initial stimulation is performed on the machine to make sure it's not too close to an actual nerve root. So if the arm or the leg jumps, depending on the area of the body, then you know you need to move the catheter so that they're not so close to a nerve root. Once that placement is accurately confirmed, then the thermocoagulation ensues, and it's usually 80 degrees Celsius for 90 seconds. This is going to vary depending on the part of the body and what the objective, and this deadens the medial branches. It's an outpatient procedure. It takes less than an hour. The results, as mentioned, can provide pain relief for up to 2 years. One big study showed 15 months on average. It's significant and longer-lasting pain relief compared to steroid injections. Patients get an excellent range of motion improvement, lower the use of analgesic medications, and a very short recovery time from the procedure. Potential complications may include spasms for a week or so due to the procedure. Actually, a person can have increased pain for months if the nerves are only partially coagulated. That's unusual, less than 5%. You may have some slight numbness of the skin for a period of time over the procedure site. Spinal cord trauma is very, very rare. The average pain relief in one study was 15 months, and when you do a repeat procedure, studies show that you can get the same results as the first time. So that's exceptional. The top non-operative pain management in Texas is through the Texas Pain Network. There are several clinics throughout the state accepting over 50 insurances and providing over 25 treatment options. The average overall success rates with the board-certified award-winning doctors is over 90%. Visit us online at texaspainnetwork.net and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Texas Pain Network. Your pain stops here.